Hello, today is November 21st, 2020, and on May 1st of 2019, I received TMJ Arthroscopic bilateral, both sides, arthroscopic surgery. And what that means is, and that was around a year and a half, 1.5 something years, 1.55, so a year and a half ago, pretty much. And what that means is they TMJ, temporomandibular jaw, I think. I'll have to look it up. Bilateral, both sides, and arthroscopic, which means they used a little TV antenna go inside under each right near the ear canal, and they drilled away stuff that was on the ball and joint socket of when you moved your jaw. And this side, my right side, was a lot worse, they said. And I got that because I've been having pain when I was eating, and it was popping to the point where it hurt every night, excessively. And it was a pain, both literally and emotionally. So I got that surgery done, and this is sort of like my 1.5 year report update, because I did a 5-day update, and I guess it's time for a new one. It still hurts and it still pops. Not as bad as before. It hurts to the point where I still now need to take Advil, Tylenol for headaches, and it pops, especially when I yawn, when I chew every now and then, and it got to the point where I'm going to go back to see an oral surgeon for next steps. What I've been told is, when I went to the dentist this week, physical therapy might be the option. If not that, then of course surgery. I do not want it to go. I mean, they both suck, obviously. It sucks doing physical therapy, and it sucks to have surgery again on your body. And I hope it's, of course, physical therapy, but it sucks. You think it's not a silver bullet, but it's what it is. Would I have done this surgery had I known this outcome? Of course, because it was 100 times worse. 100 times worse. And then, of course, the PT was worse. Not worse, but it was still bad. Because when I got my surgery on May 1st of last year, I did physical therapy for 2 months. No, sorry. Was it? There was one I did for like 3 weeks, and then one I did for like a month and a half. And like there was one of them that was for like, I had 2 exercises, and one was like opening my jaw and closing it for like 15 minutes straight every 3 hours that I was awake, and the other one was doing my neck exercise, going left, right, up, down for every hour. It was intense, but of course I do not want to mess with the jaw, so I did it. I one of the most extensive things I've done to my body is doing that PT, and it sucked, but I did it, and because I do not, like I said, you do not want to mess with the jaw, and you want to make sure you get it right. So I did it, and through the endeavors, I'm going back to the drawing board because it hurts again today. It's been hurting for the last few weeks, monthish, maybe when March 2020. That's when it started the pain started to appear again, and it got to a point where this week, I got to do something about this again, and the dentist was the perfect opportunity to probe and ask about the jaw, and they're like, yeah, it's either PT or more surgery. So that sucks, but my road to recovery is not over. Would I have gotten the surgery? Oh, yes, it was 100 times worse, like I said, but it was well worth it. This outcome, not desired, and I'm still on the road. But here's how it is now. Let me take the pop filter off. Ow. Yeah, yeah, that can happen. The big pops. Uh, I wouldn't wish it on my worst enemy, and it sucks. But what can you do? You know, humans are infallible, bodies are complex, um, and I hope my visit with the oral surgeon next week or whenever it happens, pending restrictions of COVID-19, that I get some good news. Well, that is PT and not more surgery, but we'll see. Until then, um, I will try to not pop as much, even though that's pretty hard to do right now. Even just normal, everyday yawning, pretty much impossible. Eating still pops every now and then. And it looks like I'll be taking headache Tylenol pills for the foreseeable future until I can fix my jaw permanently, and I hope that it's a easy road to recovery. So we'll see. Have a good one.